Andy Johnson, Minnesota State University, looking at 3 deficit areas with students with reading difficulties and a transactive view of reading. A child is a struggling reader. Okay, well and good. Child is reading below grade level average. Okay, well and good. But why? What are the deficit areas? It's not good enough simply to say the child is below average. You must define the deficit areas, and there's 3 of them. A child who is a struggling reader usually has trouble with word identification skills, and this is different from phonics. We use 6 ways to identify words. Phonics is the least efficient. We use semantic syntax as well as phonological cueing systems. Talk about that in a minute. Fluency, the ability to recognize words quickly and effortlessly. That's called automaticity. And comprehension. Yes, we can recognize and read fluently, but we're just not able to create meaning with text. We're not able to understand what we read. Depending on the deficit area, we approach remediation differently. One size does not fit all. If a child is having trouble with fluency, their instruction should look much different than a child who is struggling with comprehension or word identification skills. That's why it is so important that we have an adequate diagnostic, that we don't use standardized tests. Instead, we use some form of a reading diagnostic assessment or an informal reading inventory. Now, this is the transactive view of reading based on the latest research in neurocognitive psychology. Reading is creating meaning with print. As we input data from the text, it goes to the thalamus, but we don't use just one cueing system, just phonics. The brain uses 3 cueing systems: syntax, which is word order and grammar, and semantics, which is using meaning. Of these 3, phonics is the least efficient. Now, here's what the brain research has told us. There's almost 10 times more information flowing from the cortex down than from the thalamus up. That means we are using meaning more than letter clues. The outdated view of reading, the phonological processing model, simply says that there's a one-way flow of information from the text to the phonological processing system and up. This is outdated. It's a not very efficient way of reading as well. In the brain, more information flows from the cortex to the senses than from the senses to the cortex. All right? This is the latest view, the transactive view. Our instruction must reflect that.